So today we're going to be undertaking a cranial nerve exam. I'm going to be going through the 12 cranial nerves. Do you have any questions?
No, that's fine.
Okay. So the first cranial nerve that we're going to be doing is the optic nerve.
Okay.
So I'd just like you to look at this light. Okay, you can see this okay?
Yeah.
Alright, now just let me know if you just focus on a point ahead. Let me know when you can no longer see this.
Now. 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 Now.
Okay. And I've just got this board with some letters in.
Yeah.
If I could ask you to read from that line.
Yeah. D, P, C, Z, L, F, T.
Okay. And what's that letter?
C,
Okay. That one.
E, T, D.
Perfect. Just looking straight ahead. Okay. Alright, and now I'm going to be doing the olfactory cranial nerve, which looks at your sense of smell. So if you could place one finger on your nostril. Thank you. And can you smell that?
Yeah.
Okay. And again, what can you smell?
Oregano oil.
Perfect. And just place a finger on the other nostril. We already know what the smell is, so just let me know. Can you smell that?
Yeah.
Okay. Any differences at all?
No.
Okay. Just making sure there's no issues with your nose at all. Okay. Perfect. Okay. Can I just ask you to pop your hair behind your ear? Thank you. For the next two nerves, we're going to be doing oculomotor and the trochlear nerves.
Okay.
This is responsible for eye movement.
Okay.
So, if you could please look at the pink pen, and I'd just like you to follow that. So I'm going to start off with some very slow movements. So just trying to take the eyes in all of the possible directions. Make sure there's no spots. Please do blink if you feel your eyes getting dry. Perfect. I'm just going to do some slightly faster movements. Okay, just relax your eyes, just blink a few times. Perfect. Okay. Now if you could please look up and down, left and right. Okay. Do you mind if I just touch your upper eyelid? Okay, and just look down. Okay, I'm just going to touch underneath. Is that right? Look up. And up. Okay, that's perfect, thank you. Now, the next nerve that we're going to do is the trigeminal nerve.
Yeah.
So this is a nerve that sits here.
Okay.
And it sends sensations, messages to the brain from the face.
Okay.
Some people suffer with trigeminal nerve pain, and that can be felt at the eyes, the back of the throat, and around the ear area.
Okay.
Do you feel any of those pains at
No.
all? Any time?
No.
Any kind of flashes of pain at all?
No.
Earaches? Do you suffer with those?
No.
Okay, good. Right. So no pain when I
No.
touch there. Okay. Pain here?
No.
Okay. And this is good. Okay. Please close your eyes. I'm going to be touching you somewhere on your face. I'd just like you to tell me if you cannot feel it. Actually, tell me if you can feel it.
Okay. Yeah. 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 Yeah.
Okay. And now I'm going to touch you with a slightly sharper. If you just pass me your hand, that's what it feels like. It's not painful.
Yeah.
And I'm going to alternate. I'd just like you
Okay.
to say sharp or soft.
Okay.
So if you could close your eyes.
Soft. Soft. Sharp. Sharp. Soft. Sharp. Soft. 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 Sharp. Soft. Sharp. Sharp. Soft.
Perfect. I'm just going to run this along the sides of your face.
Okay.
Just let me know if it triggers any pain, so otherwise don't say anything.
Okay.
Nothing?
No.
Okay, perfect. So the next nerve that we're going to be looking at is the abducens nerve,
Okay.
and this is in relation to the gaze of the eye.
Okay.
So we'll just do some simple tests to begin with. If you could look at my nose, and at the wall behind me, and at my nose, and at the wall behind me. Okay? I'm going to come a little bit closer now.
Yeah.
And at my nose, and at my ear, and at my nose, and at my ear, my nose, and at the wall. If you could try and look that way, at my nose, and at the wall. My finger, and at the wall behind. If you could change your gaze to the wall, let's try to be as directly behind my finger as possible. At the wall. And at my finger. Okay? At my finger and at the wall. Finger, wall, finger, wall. Okay. I'm just going to come a little bit closer. Please let me know if the light is too bright. Just blink a few times. That's great, thank you. The next nerve is the facial nerve. So I'm going to pop some gloves on because I'm going to be touching your face a little bit. Okay. I'm going to be just testing how well your brain sends signals to your facial muscles.
Okay.
So if you could just copy what I'm doing.
Yeah.
Okay. Okay, that's great. And if you could just push against me. Okay, relax. And frown. Push against me. That's great. And smile. Push against me. That's great, thank you. If you could grit your teeth. Okay, relax. And just clench your jaw. And relax. And clench. And relax. Clench. Relax. Clench. Relax. And surprised. Okay. If you could close your eyes, try and open. Okay. And try to stop me closing your eyes. Okay, that's perfect, thank you. Right, the next nerve that I'm going to be looking at is the vestibular cochlear nerve, and this one is responsible for balance. I'm going to take a step back. I'd like you to stand up, and I'm going to give you some instructions.
Okay.
And place one finger on your nose, and stand on one foot. And please swap, so finger on your nose, your other leg up. Okay, and relax. And if you could lean to your right, and then lean to your left. Perfect, take a seat. The next two nerves, glossopharyngeal and the hypoglossal. If you could just open your mouth slightly, and if you don't mind, I'm just going to have a look. If you could swallow, okay, and stick your tongue out, in. Okay, that's perfect, thank you. Okay, and the final two nerves for today, we're going to be looking at your vagus nerve. So, can I place my hand just on your chest? Okay. Do you suffer with palpitations?
No.
Okay. Please have your wrist.
Yeah.
Just checking your pulse.
Yeah.
Okay, that's great. Okay, that's perfect. Now the final nerve is the accessory nerve, so it's responsible for your movement. I'm going to give you a set of instructions. Please look up, look down, look left, look right, and relax. You can put your hands like this. I'm just going to get you to push against me. Perfect, relax. If you could touch my hand with your thumb from your left hand. Okay, and now please do the opposite. Okay, and your index finger from your right hand on my index finger. Okay, and now do the opposite. Okay, that's perfect, thank you. Okay, any funny sensations you're experiencing?
No.
Tingling?
No.
Anything that you're only getting on one side?
No.
Okay. Just checking for any unusual swelling on the brain. Okay, I'm very happy with your cranial nerves. You've passed all the tests. Thank you very much for coming in.
Thank you.